Councillor Pearson. Moved, seconded. Powers, all in favor? That's carried. Now to public delegations. We have a delegation from Mark Holland from the Heart and Stroke Foundation. Mr. Holland, you're welcome to come forward and address the committee. Do I have the right? I'm sorry.
No, just one.
Apparently the delegation's not here.
It would appear so. It'll appear on the next agenda as well.
Okay. With permission of the board, we can postpone that appearance and hopefully give you another opportunity. A delegation from Mitchell Blau from Environment Hamilton. Mr. Blau, I know you're here. Please come forward. And welcome.
Best now? Very straightforward. As the keys. Okay.
Make sure you're right on the mic.
We all good? Yeah, there we go.
You can move it up a bit. There you go.
Thank you. I'd like to extend my gratitude on behalf of myself and Environment Hamilton to the Board of Health for hearing our delegation. I'd like to present on the summer project Environment Hamilton ran called Dustbusters. This was essentially a project that sought to document fugitive dust and drag out in Hamilton's northeast end. The project began essentially on Lorna Moreau's presentation to this board on May 7th, 2012, and emerged from the growing body of data, a lot of which was accumulated by Clean Air Hamilton on the extent to which particulate matter was a sort of a chronic feature in Hamilton's northeast end, and the growing body of data that illustrated that not only were there particular locations that that featured particulate matter in levels far exceeding the citywide norm, but that there were considerable and non-negligible impacts on health to Hamiltonians. So we sought to outline a series of the essentially, we wanted to grab a snapshot of some of the worst offenders all across Hamilton's northeast end, ranging from, as you can see, Wentworth Street North all the way down to the QEW, essentially along Burlington. This is a picture of ArcelorMittal Dofasco, Gate 8 on Ottawa Street North. It's worth noting that ArcelorMittal Dofasco is one of the industry locations that was most consistent with their sweeping and dust management practices. But as you can see, dust is still a major concern. Part of that is that there's an ongoing community of trucks traveling to and from various sites all over the northeast end, creating major dust concerns all over the place, regardless of implementation practices in one location. It would seem to call for a more standardized approach. This is an example of budget bin, which is on Sherman Avenue North. This is an example of drag out. This is the symptom we were looking for, but of course the drag out is not representative of the health concern. The health concern is the aerosolized particulate matter. This exits from about a 5-acre lot that is unpaved and was pretty chronically dusty. This is an example of Hamilton Specialty Bar, also on Sherman Avenue North. Hamilton Specialty Bar rarely featured drag out, but almost always featured fugitive dust concerns. As you can see, a large unpaved lot. It sort of limited our ability to report this particular location to bylaw. This is an example of Wentworth Metals Recycling, which has actually witnessed some paving as well as some gravel since this picture was taken. Here's another picture. Now this location, like many others, is embedded right in the middle, right in the center of a community. having spoken with members of the community, they frequently emphasize the importance of keeping windows closed in the summer, lest dust accumulate on dishware, and the negative impacts that has on housing, and not to mention quality of life. This is an example of Triple M Metals. This is farther east, located on Brampton Street between Strathern and Parkdale. This is actually two sites right across the street from each other, featured drag out fairly chronically, as well as fugitive dust concerns. This is Posnor on Beach Road. Again, dust and drag out was featured, but the primary concern was fugitive dusts that were most visible inside the site as opposed to just at the external exit. This is an example of a place that was not on our initial list. There were many others like it. Initial list of chronic huge areas of concern. This is more characteristic of all of the other locations, not the large industrial facilities, but the others that are in and around them. It's an entire community of unpaved lots, and as a result, the Northeast End has a particular matter problem. This is a picture of Canadian Liquids Processing on Dixon Street. That's between Burlington and Brant Street. This highlights one of the key weaknesses of the Dustbuster program, which was that we were limited to essentially roadside accountability. Those sites that were located too far from the road were outside of the realm of, they were too far away from public viewing. We could not get any good evidence, but on the occasional day you can see ambient dust. In my time running the Dustbusters project, I was able to spend a fair amount of time communicating and discussing particulate matter concerns in the Northeast End with community members in those areas. They expressed a combination of optimism and pessimism. Pessimism in that dust had been such a major feature of the Northeast End for so long that it was hard to imagine it without it. And optimism in the sense that they assumed it would get done one day. They just didn't think that day was soon. I can say that we, in Environment Hamilton and myself with Dustbusters, were very excited about the initiative and the forward momentum Council is showing on this issue, especially with regards to the October 15th motion. And we look forward to the ongoing progress on the issue. Thank you.
Much, Mitchell. Thank you. And I have a speakers list. Councillor Marula would like to speak. Go ahead, please.
Thank you, Mr. Mayor, and welcome, Mitch. Mitch has been very active not only with Environment Hamilton, but he's been active in the community on hand and attended community meetings in my area, as well as engaged residents in assisting in this endeavor. And through you, Mr. Mayor, to Mitch, with respect to what solutions, we've identified the problem areas, we've identified the problem itself. What tangible solutions do you believe we can pursue at this time to try to mitigate some of these issues surrounding the identified problem areas? Through you, Mr. Mayor.
Requirements for implementation of best practices. Truck tire washes are an example. There was a 1999 report cited in Clean Air Hamilton's 2011 report that I would refer you to. It was a report on the effectiveness of certain dust management strategies. The gist of that was that sweeping, if it's just sweeping, no matter how frequently it is done, will only serve to aerosolize dust as opposed to vacuuming it up. That report recommended a combination approach of washing and then vacuuming, as opposed to just sweeping. Speaking more broadly, a regulatory scheme that was more enforceable. I know, having spoken with bylaw, their key test on drag-out was a public safety measure. So it seemed that perhaps the dust and drag-out bylaw was not really able to enforce air quality concerns in Hamilton's Northeast End. So a tighter regulatory framework would probably be the best solution.
And not unlike other situations surrounding particulate matter or emissions in town or any municipality in Ontario, do you find that those regulatory or lack of regulatory legislation is really the biggest challenge at present?
Yeah, I would say so. The biggest challenge is convincing essentially what amounts to local businesses to incur the cost to implement what are, can range from fairly cheap to fairly costly dust management practices without any other incentive. The legislation just needs to provide that incentive.
Right. And through you, Mr. Mayor, at present, as we've discussed in the past, the legislation is voluntary and not enforced. So in many ways, the Ministry of Environment officers are limited or handcuffed with respect to even pursuing someone that might intentionally be contributing to the problem. So not unlike any other issue surrounding the environment, we really are in a position where we need to empower businesses to comply. And through you, Mr. Mayor, we are in the process, as Mitch is aware, and in working with Councillor McCaddy in establishing a pilot project in Hamilton, an airshed pilot project in Hamilton to address some of these particular issues. The ironic thing is, and I think even almost laughable, is the fact that the province allowed Oakville to be a pilot for an airshed problem and finding solutions. So through you, Mr. Mayor, to Mitch, with respect to your understanding of the Oakville airshed versus that of Hamilton's, can you just provide some sort of, I guess, comparison and why Hamilton would be a better target for such an endeavor?
Oh, well, Hamilton is by far a better target. Hamilton has a long-term industrial exposure to the air quality. I would actually, Linda, if you were interested, Linda Lukasic, Director of Environment, Hamilton, has more extensive experience with regulatory frameworks and the disparity between Hamilton and Oakville. But I can speak to the fact that Hamilton is almost certainly is more legitimately considered a compromised airshed than Oakville, simply as a result of long-term exposure to Dofasco, Stelco, steel mills.
Right. So it would make far more sense for Hamilton to be the site for that pilot project, in your opinion?
Undoubtedly.
Yes. One other aspect that I think was brought, that I think is an important one, is the solution, Mr. Mayor, of people having to close their windows during the summer months. Mm-hmm. Interestingly enough, demographically speaking, we're probably dealing with some of the most challenged areas economically. And sometimes air conditioning, or in most cases, air conditioning is not an option. So through you, Mr. Mayor, to Mitch, has that's obviously been taken into account and discussed from a social perspective, how the environmental issue itself is contributing to some social implications?
Absolutely. If you recall, I believe it's slide 4, it should be in the handout, measuring mortality. Those measurements were acute measurements, so those are year-over-year deaths precipitated by poor air quality that precipitated a heart attack or a stroke. That doesn't measure the chronic effects of a compromised airshed. Those include lower respiratory capability, which has all kinds of influences on or has impact on the number of days one can work per year. Essentially all the standard measures of economic output of a workforce.
Okay. And lastly, and if I could just reserve the right to speak at the end, but lastly to you, Mr. Mayor, Mitch, if you could have a wish list of any kind, what would that wish list look like presently? And could you perhaps develop it for us and present it to us in a formal manner?
Well, first I'd be happy to do so. My wish list would be a one clause obligation upon those operating in the communities in the Hamilton's Northeast End to demonstrate that they are compliant with a series of air quality protocols, basically compliant within a set range of limits for particulate matter, like PM 2.5 emissions, PM10 emissions. That checklist would be ideally enforceable at the municipal level. Any other regulatory scheme will probably produce results that are a bit slow for constituents. And I know that's your primary concern.
Okay. And if I can reserve the right to speak later, I'd appreciate it. Thank you, Mr. Mayor, and thank you, Mitch.
I guess much along the same lines as Sam. I mean, most of those sites are pretty common and pretty well known to me. And we're currently working with, you mentioned Wentworth. We've got an agreement down there where we're doing some pavement, but it's all voluntary and certainly by moral suasion. I guess my frustration continues to be, and I think Sam's talking about the wish list, but you know, what's next? I mean, what do we need to do? I mean, this stuff is all very obvious, you know, and you show budget on Sherman and you show specialty metal, you know, I mean, just the Stelco lots alone. So, you know, in some of the areas we're dealing with the reality and the fact of what the rules are. You know, I'm forever on the phone, whether deal with Venetian meats or whatever, saying throw some stuff on. They throw a chemical on the areas, and I guess it keeps the dust down. It's just not watering. So, I guess as much as I want to see a wish list, I would like to see, you know, what the strategy could be moving forward, which I assume is part of that wish list. So that's where I am, Mr. Chairman and Mr. Mayor, with respect to this item, because, you know, I think in terms of the other reality, you know, I'm down in the Keith neighborhood chronically, certainly in the Gibson neighborhood chronically, almost on a daily basis. And I think it's not so much that people don't cope well with it. They do. I mean, we have air conditioning down there, and they may be marginalized, but there's a lot of those things are in place, but it's still terrible. It's absolutely terrible. In fact, it's just not in those neighborhoods. That stuff creeps up. I mean, I live in Councillor Marula's ward, and I can't leave windows open at certain periods of time either. So the bottom line is that I guess the frustration continues to be what's next, or that we can do that'll not just make some noise, but obviously get something that could correct some of this. So that's where I lay with it, Mr. Mayor, and I appreciate the opportunity to speak to that. Thanks.
Thank you for your question. When I was first introduced to the project by Linda Lukazik, we talked about it in the context of low-hanging fruit, that there are simple solutions to what is essentially a large-scale, endemic, and really effective problem. The single simplest change would be a tweak to the ways in which bylaw enforces the dust and drag out, the bylaw. Their current enforcement test relies on an examination of, it's a safety assessment, essentially. And their primary concern is being able to demonstrate in court that it was a public health risk. It would seem like there's a bit of a disconnect in the connection between bylaws enforcing and public safety bylaw, the streets bylaw number. I have it written down, but I won't bother. Won't use your time that way. The easiest solution would be a change to how bylaw enforces the dust and drag out bylaw.
So given what we've done with Glenwide and Wentworth, where we have meetings regularly with the owner and his dad before that, is that an example of what you're talking about? Like, we really have this agreement now in place, and I mean, it wasn't easy. I mean, and it's really a double-edged sword, Mr. Mayor and Council. You know, we tell them to wash the streets down. If it's cold, it freezes, and then cars are sliding. On some occasions, or the fact is that you put it down in the track and mud all over the place. And so, I mean, is that an example, though, of what we can accomplish in the short term? Is the continuation of that how we've just hung in tight with that group and pushed and pushed and pushed, and now we got Howard and his sons all sort of on board?
The accomplishments are definitely noteworthy, and they speak to the momentum on council on this issue. I would say that they are that those kinds of efforts are fundamentally reactive. The problem occurs, and then council, and oftentimes particular councillors, must use their time reactively and in often very inefficient ways to, as you said, morally swayed emitters. A simpler solution would be an across-the-board requirement that, if not met, would produce actionable, essentially, consequences.
Councillor Marula, if you could chair for a moment. I'd like to point out to the board and ask Mitchell for his comment. The easiest, simplest thing to do would be to insist on paving all of the surfaces. which is the case, I know in California and other jurisdictions, we have people come from the States who say, you never have this in, Los Angeles or someplace. However, if you did pave everything, then the dust would typically run off, because the dust is always being produced by something, and then it would run off. So is there any assessment of the effect, through you, Mr. Chair, of what happens when it runs off and ends up in the water system? Is it, like, what is that material, and what's the best destination for it? And what happens if it is simply run off over paved surfaces?
Unfortunately, that question lies outside the scope of my work with Dustbusters and my scope of my understanding of the problem. That being said, essentially, what the problem in the Northeast End is essentially one of trying to facilitate the cohabitation of multiple communities. One of those communities is an industrial community. The other communities are residential in nature. There will always be overlapping areas of conflict, lines of tension between these different communities. Dust management best practices may not solve on one stop all of the problems in the Northeast End with regards to water quality, like all of the different areas of public health. That being said, I would suggest, and I think the Clean Air Hamilton 2011 report, as well as the bulk of work that Clean Air Hamilton has done over the past decade or more, would indicate that the benefits of implementing dust management best practices would be so, lives will be saved. I mean, statistically, lives will be saved. Fewer people will die as a result of heart attacks, strokes, those acute respiratory illnesses, as well as the more difficult to measure long-term impacts of reducing chronic exposure to dust and particulate matter that certainly has a negative economic impact.
Right. So through you, Mr. Chair, the point I'm trying to make is kind of complex in a sense.
Yes.
There's no simple solution, but the best solution is to get that dust out of our presence. And just a final thing, and almost an aside, there was an article the other day in the paper that leaf blowers create their own kind of problem. As you're blowing your leaves, all sorts of horrid things are aerating. Are you aware of that?
It sounds very plausible. Particulate matter is particulate matter. It doesn't need to be in and of itself offensive. It can be really inert. It's just a very, very fine particle. The danger is that when you inhale it, it goes through the alveoli right into your bloodstream. If it's really, really fine, then we're talking particulate matter 2.5 or 1.0 at this stage. That can occur if you're working, you want to take a tree down in your backyard and you put a chainsaw to it, there's a little bit of particulate matter there too. So it's not a problem that can never be reduced in its entirety, but certainly I would call your attention to a chart there. So the provincial government sets a health guideline for PM10 at about 50 micrograms per meter squared. Anything above that is associated with each 10 microgram increase is associated with an increase in 1% in mortality per year if exposed consistently to that average. Now, these averages are not representative of the city at large. They're representative of point source. Yep. These are real problems for the people in the immediate vicinity.
Right. Thank you very much. Those are my comments. I'll take the chair back. And Councilor Marula, I believe you wanted to speak again.
I do indeed. Thank you, Mr. Mayor. And perhaps for you, Mr. Mayor, too, we've already heard that a Hamilton airshed action plan and air quality pilot project is something that Mitch and Environment Hamilton supports, and I think everyone around this table would support. Through you, Mr. Mayor, we've spoken with Rob Hall and the Associate Medical of Health with respect to where we're heading surrounding our previous motion of the task force itself, the Air Quality Task Force, and how we as a municipality would like to pursue more of an aggressive initiative on this particular issue. So through you to whoever would like to answer this, do we formally have to ask for a Hamilton airshed action plan air quality pilot program from the province, or would that be built into the previous motion that this council unanimously supported?
Could I ask who would like to try to answer that? Rob?
Through you, Mr. Chairman, exactly the way Councillor Marula has described it is that there will be a report coming in December, Board of Health meeting, and that will outline the processes of trying to address the issues of air quality in Hamilton. Without letting the cat out of the bag, one of the things we've discussed internally and with Councillor Marula was about utilizing the expertise that Clean Air Hamilton provides. And you've seen the many reports that they've provided. And so with the mandate that's coming forward through the Board of Health and, and excellent resources in the community through Environment Hamilton, at that Clean Air Hamilton table, we think we can start bringing forward reports that will directly be able to be approved by the Board of Health, in essence, council, that'll have a direct impact. Specifically to this question, Ministry of Environment is a member of Clean Air Hamilton. And so the best thing for us to be able to do is to start bringing forward reports to the Board of Health and get the input from the ministry about the best processes to look at how do we develop or how do we get the ministry to get on board to this airshed issue we want to have in Hamilton. So definitely, I just wanted to caution that, these things may take a little bit of time, but it's a priority for public health services right now through Clean Air Hamilton and through the Board of Health, that we start looking at proactive type of issues and identifying many types of opportunities at the Board of Health with looking at how do we improve the quality of the air in Hamilton.
Okay, so Mr. Mayor, Rob, would it be better then just to refer this information to that process rather than a motion to support the pilot project itself, please?
Well, I believe, go ahead.
Through you, Mr. Chairman, I think the best thing would be to, once the report comes forward in December, and I think it's around December 3rd, wow, it's coming up, then I think that's the appropriate time for council to make a referral to staff to bring this forward to Clean Air Hamilton and then put this on the highest level of the agenda as to what's the process involved now to get this done.
Okay, so from today's presentation, can we refer that to that process, or do you want us to delay that? I couldn't hear, I'm sorry.
I think the suggestion was we would be getting information on December the 3rd, after which we would move ahead with the referral.
I'm sorry, can you repeat that again?
We're awaiting information to come forward on December the 3rd,
Right.
which is not far away.
Okay. So
And then subsequent to that, receiving that, make the referral.
Okay, but could we not refer this for that process and then attach it to the December 3rd meeting? Would that?
Sure.
Yeah, okay. I think that would make more sense at this point. So
Okay.
at the appropriate time, I will refer this presentation to that process for it to be then part of the
Go ahead.
December 3rd.
Yes.
So that's moved myself, seconded by Councillor McCaddy.
All in favor? That's carried.
And that's about it. So I thank you very much for your time.
Motion by Councillor Power, seconded by Pearson. All in favor to receive the presentation? Carried. Thank you, Mitchell. Well done.
Thank you.
Now, members of the Board of Health, we have two discussion items. The first is item 8.1, continued funding for health initiatives for youth. And who's going to present that? Move the recommendation? Councillor Powers will move the recommendation, seconded by Pearson. All in favor? That's carried. So there's no need for the presentation. But the recommendation was so well written that how could you possibly ask for more? So, well done. Thank you. And second is 8.2, the Community Accountability Planning Submission to the Hamilton, Niagara, Hall, and the Lynn. Any discussion on? Move the recommendation. Powers, Partridge, all in favor? I'm sorry, could you speak to that?
Yes, certainly.
Please.
Certainly have no problems at all with the recommendation. My question is with regards to the funding envelopes or the zero funding envelopes in ensuing years. So it appears that the directions to the LINs, in turn the direction to us, is that they will, in their multi-year funding, Mr. Mayor, is they will maintain a level of funding, but it will not be enhanced. There appears to be no zero increase. There's a zero increase over at least for the next couple of years with regards to the the budgets in both of the community mental health promotion and the alcohol program gaming. So through you, Mr. Mayor, my assumption would be is that we would absorb the differentials within our budgets or work within those budgets, please.
Through you, Mr. Mayor, that is correct. We're assuming a 0% increase for the next year. So we have mitigated any kind of staff increases within our operational funds. When we get back to actually negotiating the next year's agreement beginning in 2014 and on, I believe the LHIN is looking at a different way of potentially adjusting funding, and we'll only know at that point in time. But for the next year, it's 0%.
Thank you, Mr. Mayor. I support the recommendation.
And on the motion, all in favor? That's carried. Thank you. We have no motions except for the ones we've already approved, so notices of motion. Councillor McCaddy, I believe you want to introduce your notice.
Thanks, Mr. Mayor. And I'd like to move to waive the rules to have this dealt with as a motion today. And the reason for that, in terms of timing, is I think this is a question we've generally spoke about in the past. I know Councillor Marula spoke to the public health impacts of a casino, but in talking to Dr. Richardson, we thought it was important to formalize that request through a motion, and that she would be able to come back with a report on that. And the issue, of course, is before us, the casino issue in the next couple of months. So I'd like to waive the rules on that basis, please.
Seconder? Marula, all in favor of waiving the rules? That's carried. And the motion?
Moved by myself, second by Councillor Marula. And we have it here before us. The City of Toronto has just come out with a report on gambling and health in reference to their process, their discussion. And we, of course, are in the same position considering a new casino for Hamilton. So we ask that the Medical Officer of Health be directed to report back on the health impacts of gambling as soon as possible.
And all in favor? That's carried. Dr. Richardson, of course, is not with us today, but there are plenty of people to pass the message along. So thank you, Councillor. General information and other business. Just before we ask the outstanding business list, I do want to point out the correspondence that we received from Minister Matthews. Dear Mayor Bertina, writing with respect to the board's resolution to appoint Dr. Hamida Megani to the position of Associate Medical Officer of Health for the City of Hamilton. I am pleased to approve the appointment of Dr. Megani as an Associate Medical Officer of Health. This approval is granted in accordance with the Health Protection and Promotion Act, and it's always good to know that you pass, but it's great to have the diploma in hand. So congratulations and welcome. Move to receive the correspondence. Powers and Pearson, all in favor? Welcome to the club. A motion now to remove outstanding business list item A, Community Garden Coordinator, as the item is complete. Pearson, Basuda, all in favor? That's carried. And I have the correspondence we've already referred to, and so there is no private and confidential. I have a motion to adjourn. Morelli, Partridge, all in favor? That's carried. Thank you, everyone. Yeah.